Tishtile Dr. Kunga Choekey or Amjala Tishtile. Thank you so much for agreeing to be here and do a Q&A session. I love that when I first approached you to do this in-person consultation, before I even told you about the details, you said you would love to do it and that you're really motivated to help others. That really moved me. So thank you so much.
I'm Tibetan. I'm Tibetan doctor. My name is Kunga Choekey. I live in Belgium and I'm here for consultation in London. I've been in Tibetan medicine from last 15 years. Yeah. Medicine we study for 5 years and 1 year internship. It's like 6 years. Then I practiced 4 years in our institute, Menzikang. Then I came to Belgium.
If I can jump straight in, we have some questions from our members and people interested in Tibetan medicine. My first question is, what motivates you?
I love being Tibetan medicine doctor, to help people through Tibetan medicine.
Is Tibetan medicine linked to religion?
It's related, yeah, with Buddhist philosophy, Buddhist mindset.
How is Tibetan medicine similar or different from other healing sciences?
Yeah, it's like not same but similar to Ayurveda, like 3 elements in Tibetan medicine, Lung, Chiba and Pagan. In Ayurveda it's Vayu, Pitta and Kapha. So it's similar with Ayurveda.
How is Tibetan medicine different or similar to traditional Chinese medicine?
Chinese also similar because Chinese based on yin and yang. So in Tibetan medicine we based on hot and cold when we treat patient.
What makes Tibetan medicine unique?
Tibetan medicine actually in the West is not so famous, but in India we have many branches. When I was working in Menzikang, first Menzikang established for Tibetan people, then it helps many Indian. Now in India, in big cities, there is many branches because Tibetan medicine helps chronic and some when Western doctor says it can't be treated, then Tibetan medicine gives life.
Is Tibetan medicine alternative?
Actually no, but in this modern world, people call Tibetan medicine as alternative. Actually, it's not alternative, you know. In Tibet, from centuries, we have a medicine, Tibetan medicine as a medicine. Tibetan medicine is traditional medicines from our ancient times, yeah.
It's really interesting you say that, and I love the way that you said Tibetan medicine is actually traditional. I hate the use of the word alternative because it pits us against Western or conventional medicine. The appropriate term would perhaps be traditional, as you said, because it's a traditional healing science 2,500 years old from Tibet and the Himalayan region, but also it can be integrative as in it works alongside other treatment plans or other conventional medicine. And the great thing about Tibetan medicine is that the supplements are vegan, plant-based, they don't have any side effects because they are all dietary in nature. I also love that Tibetan medicine, perhaps we can say that we're rediscovering traditional forms of healing that are very appropriate for modern life. Is Tibetan medicine similar to pulse reading?
Tibetan medicine, we diagnose with three ways of diagnose. First is pulse reading and urine analysis, then questioning with the patient.
What are your most common ailments? What do most patients come to you for?
In my last 15 years, I've seen different patients. Mostly in the West, I see like lung imbalance. Also more with digestion, arthritis, skin problems, high blood pressure, diabetes, different kinds. Especially with lung, mostly because in West, lifestyle and mindset, it all depends. Yeah.
How does a Tibetan medicine doctor prescribe supplements?
We prescribe according to the patient, whether it's a lung patient or it's a Chiba or it's vegan or it's with both or combined or it's with all three. We see the patients and then we treat as per what element is imbalance, what energy is imbalance.
How do you treat conditions where there is no cure?
When the situation is incurable and like last stage of like cancer, we give advice how to take mindset, like from Buddhist philosophy, we advise to calm down the mind, to think of the samsara, accepting the situation.
This is a question I often get whenever somebody discovers I'm from Tibet. They always ask me, are you from Lhasa? And obviously, only 1% of Tibetans actually are from Lhasa. It's like saying to a British person, are you from London? Are you from Lhasa?
No, thanks. I'm born in India. I never saw Lhasa. It's my dream to see the Lhasa.
And you will.
Yeah, we go back to Tibet, yeah.